Dr. Braddy-Green has recommended you undergo an endoscopic procedure to investigate your symptoms, or because you have a chronic condition that requires regular surveillance endoscopy, for example, inflammatory bowel disease. Endoscopy is the generic term used to describe any flexible fiber optic camera used to examine a patient. This will either be a gastroscopy, as seen on the left of the screen, which is gently passed through the mouth to examine the gullet, stomach, and first part of the small intestine, or a colonoscopy, as seen on the right of the screen, which is passed gently through the anus to examine the large intestine, known as the colon. Occasionally, you require both procedures, which will be done during the same appointment using separate equipment. Before having an endoscopic procedure, there are simple steps required to ensure Dr. Braddy-Green can complete your investigation. For gastroscopy. 1. If you are taking antacid capsules, for example, omeprazole or lansoprazole, stop taking these 14 days before your appointment. 2. You will need to be nil by mouth for at least 6 hours before your procedure. In reality, most patients will have a late meal the evening before their procedure and avoid eating or drinking anything the following morning. 3. You will be given additional instructions if you have medical conditions such as diabetes or are taking anticoagulant medications. The preparation for colonoscopy takes a little longer compared to gastroscopy. 1. If you are taking iron tablets, stop these at least 7 days before the procedure appointment. 2. You will need to avoid fibrous food before the procedure. It is important you adhere to a low residue diet from 5 days before the procedure. 3. You will be asked to drink a strong laxative before having your procedure. This is normally the day before and morning of the procedure. It is really important this is followed strictly, otherwise Dr. Braddy-Green may not be able to complete the investigation if there is feces remaining. At the same time as taking the laxatives, you will be asked to switch to a clear fluid diet. For example, coffee and tea without milk, flavored water, and jelly. 4. You will need to be completely nil by mouth for at least 6 hours before your procedure. 5. Like gastroscopy, you will be given additional instructions if you have medical conditions such as diabetes or are taking anticoagulant medications. On the day of your procedure, you will arrive at the endoscopy unit for your allocated time. You will be asked to complete any outstanding forms before being admitted by our experienced nursing team. Dr. Braddy-Green will meet you before the procedure to confirm you are still in agreement with going ahead. You will be taken into the procedure room and routine safety checklists will be completed. If you have opted for sedative medication, this will now be administered prior to the procedure being carried out. After the procedure is complete, you will be monitored by our nursing staff until you have fully recovered. You will be offered a warm drink and snack before being able to go home. If you have been given sedation, you will need a family member or friend to accompany you home and stay with you overnight. You will be given a copy of your procedure report.